Hello, everyone. We are live from Connecticut today, and we are heading to Providence, Rhode Island. We're meeting with my dad on an off day because tomorrow and the day after we'll be in Boston, and we have one heck of a lineup coming together. So I'm getting really excited about that. Tomorrow we'll be working with someone from MIT who's focused on innovation and arts and how all of that design can come together for problem solving. We will also be working with Dr. Chris Dede, who is one of the top researchers in education for the future. So really excellent folks to be working with, and it looks like my dad has gotten on already, so we're going to go ahead and pull him in to the conversation. And we are adding him and we're connecting. All right. Hey, Dad, how are you?
I'm all right. How are you,
Good.
busy woman?
Oh, we are very busy, I know. And today we got a little bit delayed with so many people traveling with us. It's a little bit crazy. And so I've got a makeshift background. Sometimes we just have to go with what's available. I'm not going to say it's the best option, but it's the best option for today under the circumstances. So we're en route. We will actually we'll be doing this mobile today.
Wow.
So we will be getting on the road and driving a bit, and everybody will be here. So it's about to get busy in this space. But
all right.
That's
how many
that's
do you have
how
on
we roll
board today?
sometimes.
How many do you have on board today?
There is a total of 6 of us.
All right.
Yeah, so that's quite a few personalities, activities, preferences, needs.
Yeah, well, I'm going to leave that all to you.
Yeah.
I have enough of that.
Yeah, well, today is the first day of July, and officially marks the end of our first month and the start of a new focus area. This month will be focused on healthcare, but if you'll indulge me, I'd love to quickly tie a bow around our environment focus.
Yes.
So yesterday we finished up our plan for approaching an improved plan for the environment, and particularly what we're calling it as a national environmental strategy. And that's something the United States has never had. In 1970, we did have the National Environmental Policy Act. I was going to say protection because I'm so used to hearing that word, but it's not. It's Policy Act that Nixon put together, and that was the first of its kind in the world. But we've never had a true strategy for this country, and I wasn't honestly sure if we would be able to achieve it because there's so many personalities, there are so many preferences, there are so many belief systems happening right now. And for reasons that are not typically the case, science has become a political issue. And so that makes it even crazier. But I am extremely pleased to say that we were able to pull it together. The data in the science is very clear. There are a couple places where there are some disagreements still, but they're not profound, not like you see on TV. It is very clear as to what's happening and how we can fix it. So when we get to that point, then when we aren't fixing it, it is usually a people and money issue and not a science issue. So
Right.
This is where a psychologist is useful. Yeah, and so what I needed to do was bring in the information I know from government, which is number one, how do we move money? And then my knowledge from psychology, which is number two, how do we change systems that deal with humans? And so I think it was exciting for me personally, no matter where it goes or how much press it gets. It's exciting to me personally to see that we really are at a point where this science is digestible, it is agreed upon. We have the money already in government. I do think that's something different, I'm saying, than others have said. And that is because I know how government money works. So we actually can pool it together, and we can pool our resources, which is knowledge and tools and all kinds of pieces together to actually affect change. And we haven't done that yet. So I'm excited that we're able to bring it together. We're able to make a plan, and it is a plan that can be executed in absence of any need from Congress, which was my goal. So yay.
Good, good. I did enjoy your speech yesterday. I'm sorry that we had a little tech at the end that kind of caused the end to be turned off. So I hopefully, I haven't seen it online yet, so I want to check that out. But I did listen yesterday and I enjoyed it very much.
Well, good. Yeah, the audio cut out literally in my last sentence.
I know.
So that was pretty funny and ironic that we were really able to go, but I was in a rural space.
Right.
And so, you know, that's just the reality of sometimes the way live operations happen. But I can say two things. One, there will be a video coming out that is organized, clarifying what we've done over the last month. So look for that. And then there is actually a written document that will be provided to everyone. I'm hoping I'll finish it today. All the writing is done. It's just formatting at this point. So we should be in good shape. And the goal really, I'm almost a little surprised because there's just so much information. To have brought it all together and really finished on time yesterday, I think is exciting. And it really speaks to what's available. So
I think your team did that was good then for you.
Yeah, well, I mean, and by team, I would actually expand that out to everybody that participated. And so to have so many great interviews, you know, that's what you need. You need people who are the experts in the area to participate, and you can't always guarantee that. But people really made themselves available and offered their expertise, and I think it came together nicely.
Good, good.
Yeah,
Can't
so
wait to see the final.
Healthcare. Hit me with questions.
Wow, healthcare. Geez, what a, you know, I started thinking about it even after, you know, looking this morning, but yesterday a little bit and different things. But the thing that is so challenging here is that our views on healthcare and how it works and how it's going to be distributed and how it's going to reach the mass and all that. It changed so much over the last 50 years. It's been extraordinary. It's actually quite surprising to me after thinking about all that and the changes that occurred and how they went, that we've even remained as well in our wellness around our country as much as we have, because the dynamic within the system, not only from a money standpoint, but from an actual potential, you know, how we actually are cared for and all that kind of stuff has changed so much in 50 years. It's really incredible. I can remember, and this is, don't date yourself, but I'm going to date you a little bit. I remember when you were born that I think our total bill for your birth was somewhere in the $800 range, which is probably, you don't even pay for the first pill of $800 in the birth process today. So, excuse me, I think that just tells where we've come from and where we're at today. I guess the biggest challenge, I think, is that we're going to go to is the Medicaid, Medicare, and just general health care and how we're going to proceed. My questions really center around, I know you have also documented this in a previous speech or video, but the fact is, you know, the biggest struggle here, I think, is not so much is it a privilege or is it a right, but I think the main thing is how is it going to be evenly distributed, because it's easy to sit down and talk about privileges and rights and who gets this and who doesn't. I think people worry about the wrong things when it comes to this. Are we going to help people become a healthier nation going forward? I think you spoke to this in the past, realizing that if you look across the board in the countries, the healthiest countries in the world are actually the most prosperous countries in the world. And so, you know, as much as I'd like to sit down and think that, you know, you have to earn things to get there and be, we do need to strive to get everybody well if we can. What a challenge, though. It's a real challenge on how that gets done, because we have to compensate individuals across the board along that line and disrupt a fact of, well, and I'll just use the word, the insurance industry had to roll around, and I'm not going to give them an A plus, but I'm not going to give them an F either, because they've had to face their challenges on so many different fronts in a short period of time to get things done. The whole thing about pre-existing injuries has been their biggest challenge. Most people hear it, but they don't understand it and why it occurs. So I am going to pose the question to you about, what do you see as the distribution so that it is equally, and how it is right, done correctly, so that we can prosper and be a well nation?
Well, it's always incredibly difficult. I think it's easy to say everything's going to be equal. I think anyone who's saying that is generally blowing smoke, right? We can aim for it, but there are a lot of what we call pragmatic realities, right? There's just, if you're in a rural space, the reality is you are going to have fewer doctors available to you than if you are in a city space. On the other hand, in a city space, in an urban space, you have far more people that have to be serviced, and with that comes a series of other challenges. So complete equality guaranteed is always going to be exceptionally challenging and generally speaking, unlikely for those reasons that are untenable. But that doesn't mean we don't strive for it. So I think the first question you have to tackle is, I know you said avoid the is it a right or is it a privilege question, but that is at the heart of even the attempt to make it equal access. And so I often say it's somewhat irrelevant if you think it's a right or a privilege. What's relevant is, does it help this nation be ready for any of the challenges that we may face in the future from an economic perspective, and from an ability to act perspective? And on both fronts, the answer is obviously yes. We need everybody in this nation to be as healthy as possible, because it makes you ready for work, it makes you ready for life, and it is less costly and increases the capability of the country. So I really don't care if you think it's a right or it's a privilege. It is the right answer at the national level to ensure that we're a capable nation. And so then it gets down to, okay, if that's the case, then how do you roll that out, right? And what we've done to date, the model has been individuals or businesses pay an insurance company, and the insurance company gambles on you, assesses your risk factor, and then you pay a portion and then go to the doctor. If we switch to the government overseeing some of that maintenance, then we don't have insurance companies, so we cut a lot of costs. But on the other hand, the fear is that now you have the government in charge of your medical space. Do they make decisions for you? Do they determine how much money you can spend on things? Does it reduce doctors or pre-doctors' interest in becoming doctors? Does it change the way we support research? There's a lot of questions that come into play. But I think most of those questions, one, are fear-based versus data-centric, right? I'm afraid that this will happen. And two, I think they're all addressable, right? There is a way to make sure the government isn't making your decisions, and also to ensure that it's less expensive. So how do we do that? The way I do that is I look around to see what's working, right? So we have a number, I don't know if a lot of people realize, but the VA health system is actually the largest centralized government-owned health system in the world. So we can point at all these other nations who have healthcare systems and say, well, they have socialized medicine, this or that. Ours is still the biggest, even though it only services vets and their families.
Wow.
Yeah, so that's really important to know, that we are at the highest scale of rolling that kind of a system out. And so we really don't have to look beyond our borders to be able to get that information. I always think it's wise too, because it's always great to learn from others. But we do need to recognize that we have the largest system in the world. The second thing that needs to be recognized, especially for VA, for anyone who's had a great experience, don't think that everybody has. And for everyone who's had a terrible experience in the VA, recognize that other groups do it differently. What do I mean by that? The VA system is disjoint. meaning every location operates largely independently. And so even though it's a connected system, it means that some places are essentially working better than others. So in Orlando, for example, in our VA space, we have a modeling and simulation center. And this is at the very edge of capabilities and demonstrating how we can give access both in education and training, but also in delivery methods to rural spaces, to spaces overseas, and to spaces right there in front of you. So that's what I would call a model program that needs to be proliferated, right, and copied. There's another one that does telehealth. And this is actually, I think telehealth is really fascinating because it changes the way we look at healthcare, right? We are used to thinking of healthcare as a touch-based system, right? Where you are face-to-face with your doctor and you are going through a physical exam of some sort. But there's a whole bunch about medicine that does not have to be face-to-face, right? When you're reading your x-rays, for example, getting that information could easily be done over the internet, right? We could still, I mean, here we are right now demonstrating this, right? You and I are having this great conversation. I'm literally on the road driving. Well, I'm not doing the drive, I'm riding through Connecticut, and there you are in Florida, and yet we're connecting fine. So, and the other one that comes to mind, and certainly has been demonstrated to save a lot of money, but also improve care, is being able to be home longer. So we see it a lot in our elderly patients where they end up having to stay in the hospital much longer because they can't be serviced at home. But with telehealth, we can actually keep them at home longer. It's not saying you don't go to the doctor or you don't go to the hospital. It's saying that you have options. And those options not only save you money, but actually save the whole system money and time and improve care. Because what if you're somebody who is in that rural space and you need a specialist? Telehealth allows you to connect somewhere else in the world, right? My son, so when Mitch was born, my oldest, he was one of the first that had the surgeon actually talking to other surgeons during surgery, right? Because they realized that having more than one brain making that decision, you know, more heads are better than one in this case, right? So, with the heart, so Mitch had to have open heart surgery. He had no chambers or valves in his heart. And the surgeon was only allowed 1 hour on the heart-lung machine, which means you have 1 hour to make all your decisions, and it's a high-stress, high-intense situation. So they actually brought in other surgeons to help make those decisions. And, of course, the outcome is amazing, right? As you know, Dad, Mitch, at 20 years old, in spite of all these troubles, went and ran the New York City Marathon and finished and is now planning multiple. He now is up to running 45 miles a day with a heart that should not be able to, I'm sorry, 45 miles a week. Sorry, I'm giving him
a day. I was going to go, wow.
Miles a week. Yeah, he's averaging 9 miles a day, 5 days a week with a heart that we thought was going to need a transplant.
Right.
And with Madison, my fourth child, we were in the hospital for 5 months because she was born at 23 weeks. And at the 5-month mark, I said to the doctor, we're going home. And he said, you don't just get to decide you're going home. I said, yes, we do. We were given permission by the insurance company to do home health. And we basically moved the hospital home with us. And the reason we left was because Madison could never gain weight. She couldn't gain weight because being in the hospital was so stressful that it was actually causing her to get sick and to expend so much energy that she could not thrive. So coming home was the best thing we could have done for her. There are many stories like this. I just have 2. But the point is, when we start thinking outside the box, we can start servicing everyone. We can do so at a lower cost, and we can increase at least the equity of access that we would like to achieve for this country. And we don't have to determine, is it fair? Is it a right, or is it a privilege? It's irrelevant. What needs to happen is we need to have a healthy nation to be able to thrive into the future.
I couldn't agree more on the healthy nation. I think it's vitally important. I'll throw in my 2 cents about the VA, having been exposed to them on more than one occasion. I'm not so sick that I've had to go through any major scenario with them at all, but my exposure on extended care or whatever, they're very proficient at it. Now they have clinics all through the different communities, especially down here anyhow in our area. My clinic is only like 6 miles from my home. I can go there. I have a regular primary care doctor and everything like that. So it resembles any kind of insurance company that I've ever been in. So the fact is, so it resembles that same model. The only challenge that I found is that, and it goes by, which is sometimes people get worried about, is the fact is that you get different restrictions. The VA has certain criterion that they base their decisions on, and it's very difficult for them to deviate from them. Matter of fact, even the physicians can't do it. And I think that's a fear that people have about the system as a whole. I think it's a fear that comes also from the standpoint that the Canadian system, which most of us have heard about, we're not real familiar with, but it has the same type of criterion that if you get to this point, this isn't going to happen, or if you don't reach this threshold, this isn't going to happen. I did have one of those thresholds that did bother me, which is my eyesight and having my cataract surgery, which is coming up this Wednesday. The VA said I did not qualify, and my Medicare physician said you definitely qualify. So there's a big gap between which group is administering the care. And it's kind of funny, and I've always said, and you say it all the time, we have these gaps between departments, okay? And the only reason I went to Medicare, because my eyesight was being, reduced significantly. I mean, I really was struggling. I am struggling with my eyesight to the point where the state of Florida is thinking about taking my driver's license away. So, anyhow, I went and I couldn't believe that the VA was saying no, whereas my Medicare physicians and private practice were saying definitely you can't see. The best we could do, even with corrected lenses, was 20/60. So, yeah. So the fact is, that's where the fear comes in that exchange. As far as the going to Medicare, Medicaid, I think the fear where people get in the big rush, and I'm doing the talking here, but I'll express some of the things that I hear from the folks that I'm with, is that they feel that the system is being challenged through lack of participation. They look at the poor getting care for free. And I don't know if we can totally look at it that way. I know it is a challenge within the system. Our system, Medicaid, not so much Medicare, it's mostly Medicaid that's doing the fact. But how are we going to handle that piece? Because they're not, and if it's poor people have certain restrictions on their life, period. I mean, it's just because of where they live, how they're, whatever challenges they're facing, which are numerous beyond belief because they're not successful in certain things. So how do we get past that part? As far as the middle ground, where Tom, Dick, and John who go to work every day and mom is going to work every day and, all those challenges, but we're providing for ourselves. It's the ones who are having difficulty providing for themselves that people worry about they're exhausting the system. Is that really true or not?
I think that's a bit more perception than it is reality. I mean, Dad, we certainly didn't grow up rich, and you worked your tail off all the time. I mean, why was I in college able to participate with my roommates who were extremely affluent? Because I was really good at cleaning a toilet, right? And why do I know how to clean a toilet? Because I spend my weekends going around with you doing janitorial work in commercial buildings. I don't think that we, by any stretch of the imagination, were given a handout at all. I mean, I know there were people that were poorer than us, but certainly the realization when I went to college is that we grew up poor. There were things that other people didn't have to do, and I just didn't know that everybody didn't have to do those things. And I know you worked your tail off, and lots of people do. So I think it is definitely a misnomer that simply because somebody is poor, it means they haven't worked hard enough to deserve support. There's always going to be somebody who works the system. There is always going to be somebody. But let me tell you what, there are people who are very rich that work the system. There are people who are middle class that work the system, and there are poor people that work the system. It actually is nothing to do with how much money you have. There are bad actors of every type, and I almost get a little bit angry about this one, because to suggest that how much money you make is entirely tied to how much effort you put in is inaccurate. There are we hear about it all the time. The person born with the spoon in the mouth, and the silver spoon in their mouth, right? They money begets money and everything else. And if there's one thing I learned when I went to college, being the person who was on scholarship, who worked my tail off to get there, was that what I'd been sold as the rules of the game were inaccurate. And so what I think happens a lot of times with people who are working poor is that they're working their tails off, but they aren't necessarily working within the rules of the system. People haven't taught them what I call game rules. And when you don't have those game rules, it means you're working just as hard, but you're not necessarily getting as much traction. And I don't think that's a reason to deny somebody basic support, because if nothing else, again, going back to national readiness, you decrease the possibility that they will have the opportunity to better themselves, because if they are that hardworking, they will be able to move up over time. And you just decrease the possibility that their children will be able to get ahead and be able to get better jobs and better situations. So no matter which way you slice this, we need to ensure that all people have access. And I understand people feel like that isn't always fair, but there isn't data to support that feeling. I think that comes more from fear than anything else. But then to get into the difference in Medicaid, Medicare, VA, and then insurance, that right there is too many programs. Right? Think of just the basic. You don't even have to know anything about our programs to know that having that many means we're being inefficient in the way that we're solving problems for healthcare. Why should every system be different? And so, to your point specifically, you said, I get a yes from one group by criteria, I get a no from another group by criteria. Which one is correct? The way that we solve this in government oftentimes is to make more rules. You probably heard me say, but for those online who haven't, I talk a lot about the FAR, which is a book that the title stands for Federal Acquisition Regulations. And it's about this thick. And it is all the rules that we put together to ensure that we do fair government contracting. And the only thing those rules guarantee is that we will never achieve fair government contracting because the only people who can participate are people who have enough money to pay somebody to know all those rules, or people who enjoy working the system, like enjoy the challenge of working the system enough to work around those rules. So my analogy carries through game rules, right? Well, the same thing happens no matter what system you're talking about, including healthcare. When we have so many rules to follow, we actually ensure that we will not achieve success. So the better way to do this, and we've worked a lot on this in defense in other areas, is to look for connected bodies of influence. So what do I mean by that? If you've gotten a degree as a physician and then you are board certified, there are groups that are looking over your shoulder to ensure that you're participating appropriately. And we don't have to govern that yet again and again and again. We have to put some trust in the experts. Yes, there are going to be bad actors that sometimes abuse that. By and large, though, you will actually guarantee substandard care if you don't put some trust in people. So at some point, you have to find where that balance is. So the way you handle that is, one, you create criteria up to a point, and then you create a pathway to go around that criteria as needed. So in your case, Dad, when someone says no about the cataracts, there should be a way to file against that where the doctor says, here are the 3 reasons why this actually does need to occur, even though he didn't meet criteria. Where that breaks down right now is that we don't have the system in place efficiently to review those exceptions. And it gets down to people power, and it gets very costly. And so the blanket answer is no. That's very easy to change. And I speak from experience because Madison, my 4th child, was part of the Social Security. We got SSI, and she was on Medicaid. I know how these systems work on the receiving end. And we dealt with this inside of government. So I know how it happens on the decision-making end as well. This is a solvable problem, but the only way to solve it is to have somebody who understands how this entire system works, to include how people receive it, which means people like you should be on the board helping make these decisions. It should not be just experts, and it should not just be people who sit behind a desk, and it should not just be people who are politicians. We should have we call them the users. You would be a user of this system. Mm-hmm. You should be present as well.
Yeah, I think you're bringing up one of the most valid points. The fact is, what happens, and this is where that challenge would be, is the fact is that the review process is so long and engaging that it doesn't get done in an expeditious process. And that was the one thing that having, you met our friends from Canada, and talking to Dale and Dave, the fact is that their process they have there, but the review process is so elongated that they sit down and somebody that has borderline kidney problem, depending on whatever it is, let's say, I'm just using that as an example.
Right, sure.
It could be 12 months out for them to get a decision regarding the care that they need for that, which potentially could result in having, something go wrong simply because, the body isn't going to wait for the decision. Right. It's going to sit there and continue to do what it needs to do, okay, and fail or succeed. I think that the reason I brought up what I did was the fact is that didn't seem to be a common thought about what the care should be.
Sure.
Meaning that at one place it was one thing, and over here it was a different criteria and different things. And one of the things that I always thought, and when you brought up, we were rich. One of the things that I did, and playing by the rules of life, I wouldn't take a job unless it included health insurance. That was one of the criteria in accepting a position with a company. Didn't matter what it was with or who it was for, what I was doing. If it did not include health insurance, I did not take the position because I had a family to take care of, and I understood that piece. When the Affordable Care Act was supposed to be put in place, they complicated it so bad and messed it up so bad that they could have easily done it, including the insurance companies, by saying, here's a schedule of mandatory benefits that all employers have to have, period. Done. I mean, and a schedule of benefits.
You should run for president, Dad. You've got to figure it out.
Huh?
You should run for president. You've got to figure it out.
It would have simplified everything, and it still would have remained competitive in the marketplace. It would have still allowed, anything. But the fact is just say, here's the mandatory schedule of benefits that all employers are required to have their insurance, or every insurance company that is going to insure health insurance. This is what they're going to follow. Plain and simple, done, whatever. Instead of 40,000 different, rules and regulations that ended up being more, fireplace fodder than anything else and confusing the whole process. Okay. So, and, it's unfortunate we got to that point, and at this point now it's a political hot potato, but it would have been a much simpler way of saying that's what happened. A lot of employers were fighting it, but the fact is, why fight it? If it's an even playing field, okay, once you level the playing field across the board, competition is no longer an issue simply because you're sitting down playing with all the same cards in the deck. I mean, it doesn't matter at that point. We miss that point on so many other issues. It's funny that, you know, all you have to do is level the field, level the playing field, and then the competition is fair and equitable. They don't change the rules in football for one team and play it different for another team. It wouldn't work. And it's the same in some of the things that we try to solve. If we would just agree on a single rule for everyone, then it would, you know, it works. It works good. Anyway.
But you're assuming that everyone wants to have a level playing field, and when you
of course I am. That is,
there's certainly those that want to. Yeah. But Dad, I want to point out one thing that you said that I'm not sure if you realized was a really important point, and that was that when you looked for a job, you looked for one that had health care and other benefits, of course, right? But the way that we are looking forward to jobs of the future, they will not be set up the way they have been. In fact, tomorrow I will be interviewing with Dr. Dede from Harvard, and we'll be talking about the 60-year curriculum, which expects that people will have 3 to 6 careers in their lifetime. So where you in your generation had one general career that built on itself, it meant you took long-term positions and you grew through those positions. The generation after me will be constantly changing positions. You're already seeing it, but it will become more and more common. And what will happen is you will be, as an individual, a commodity, and you will go from different groups. Why does that matter for healthcare? Because it means you're less likely to stay with a single company, and you are more likely to be an independent agent. And that means the healthcare needs to reside with you personally and not within a company. And that is a huge reason, an economic reason, to change the way this system operates. Because the minute you can have healthcare, your employment opportunities change completely, right? We now can service groups as independent consultants in a completely different manner. And that puts a lot of power into all of our citizens, but it also puts a lot of power into our businesses, who then can have the best person from this arena, the best person from that arena, and they can do so on limited time frame. Everybody gains opportunity, choice, and the ability to build up their expertise in an environment like that. So I think healthcare and the economy they're going to come together and have a real back and forth influence. I know, unfortunately, that's not going to be common in your group, but it is very important for people of generation under me.
I used to talk to folks about this when, you know, and certainly I did gain some. My employment record finally started improving quite a bit, so I was doing much better at different things. But the fact is as we progressed through looking at people who came in on board in management positions and stuff, and I also found out that, you know, when I was growing up, people didn't move only about 2 to 3 times in their lifetime. And they probably only held 2 jobs within that entire period of time. Yeah. By the 1990s, it was going to closer to what you're describing. It was about 5. You were going to have 5 different jobs within your
Those are
life,
jobs, not careers. Different.
Not careers, exactly. Jobs
right.
within the same career field. Okay.
Yeah.
But you were gonna move probably 5 times. Now, I think people are moving at a rate of every 18 months. They're moving from one to another. I mean, it's really changed significantly from that standpoint, and that's why when you talk about a universal system where it kind of has to, I think you have to look at those as you know, one of the things that to avoid. I mean, business love to avoid cost. Okay, they're going to do anything they can to avoid cost to the bottom line. But one of the things I remember clearly was when we used to get a government contract, it was mandatory that us as an employer, we would have to sit down and actually include health benefits within that structure in order to be a subcontractor within that environment. I think you almost have, and that's where we get in the argument of regulated and unregulated and what's going on. And that's why this is a very complex issue. Medical somehow has to get paid for somewhere, someplace, somewhere. How? I mean, I don't know how you're going to do it unless you're just always doing it from the individual side or from the tax side or however. But somewhere along the coin has got to fall into the bucket. Are you going to do exactly what you said? How are you going to attract people into the industry? How are you going to sit down and increase research? How are you going to sit down and do all the back end that no one sees? I mean, the only person they see is the guy in the white coat. And he has a stethoscope around his neck, and that's where the healthcare starts to begin. Well, it's the iceberg under the water that really becomes the major problem that's going on. And so I hope we can solve it. I hope I hope you understood it, but you're not normal. You're not normal. I mean, you knew what you were wise enough to say, I'm taking my daughter home simply because she's not functioning well enough. You're so much better equipped to make that decision. You're one in 10 million that could make that kind of a decision. There isn't a tremendous amount of folks out there. So that's where the other challenge comes in, is making sure that there's healthcare professionals that are helping make those decisions too, rather than not. But I don't know. I wish there was an easier solution to this rather than a single payer type thing. I think your three-tiered plan was quite well laid out, and I think in the future, I don't know, is it posted on YouTube?
I think it is posted. So, but to recap it very quickly, one, I think there's enough money in the system the way that it's running now to actually reduce the cost of healthcare. And so what I mean by that is you've got VA money, you've got Medicaid money, you've got Medicare money, and you have what employers are currently paying. They're just paying it in a different direction. And then you also have what individuals are paying. All of that together is currently very easily understood to be inefficiently spent. So when you pull it together, you should be able to reduce that's easy to understand. But then the question is, what is that setup? And that's where the 3 tiers comes in, right? The first tier being what's essentially, this would be universal healthcare. So it's kind of like an HMO right now, where you pay a copay and you have in-network doctors. Then you can pay extra if you want to have no better care per se, but maybe wider access and choices, right? So I call this choice healthcare, and it would operate much like a PPO. And then the one that's coming into play, where I think you could have lots of competition, is into what I call concierge medicine. And this is where it's individualized. This is getting into some really high-tech work that can be done, some research. It's where a lot of companies could make a lot of money. And it's only newly capable at this point, because we just now are getting to the point where all that digital data can be moved about safely and securely. So that would come with an extra premium. And this would really be for people who, for one reason or another, probably don't have a lot of time or have major issues that require constant monitoring. And so you're talking about great care for everybody, more choices for those who really want it, and specialized or individualized care for those who really want to be taken care of in a different way. But all of that information can help support care for everyone. So I think it would be a neat system. I think it would be extremely effective. I've certainly I've been a recipient dealing with medical issues for a long time, so I definitely qualify as a user. But I know on the inside that we have figured out how to move data safely, securely. I know on the inside, when I say inside the government, through Department of Defense, we have figured out how to make sure that we have individualized support, that we can provide information and healthcare to our rural or disadvantaged individuals much better than we are today. All of this information exists. I'm not saying anything that is not already a mature capability. I'm simply bringing it together. So I think that is where we have a win, and that's probably where we probably need to close out, is to say, have hope. I don't think it's, I don't think in any way that we're in a bad situation. I do think we can maintain the commercial space for those interested in that competition. We can provide care to everyone, and I think we can reduce the cost. And we just have to connect all the dots. That's it.
Okay.
It's simple. See?
Oh, it's simple. Yeah, Well, that's always the best. Keep it simple, stupid. You know, give it the old kiss, and everybody's happy. But
yeah, I think we've overcomplicated it because it sells in the media and it sells for politicians. We haven't overcomplicated it because it has to be complicated.
yeah, well, and I think we're talking about several issues that have the same, have that same illness. Right. So anyhow, I don't know what time it is. How are we close to?
It's time for us to close on out.
Is it?
But thank you, Dad, for joining
us.
How's
the trip? Where are you headed in today?
We're going to Providence today, and tomorrow we'll be in Boston. We'll actually be in Boston for 2 days because, as I was saying when you came on, we have 2 great interviews tomorrow, but I have 2 that I think are going to hit the day after, both of which are going to be in some very high-tech cyberspace, digitization, automation platforms. You might imagine Boston's got some real leaders in that area, so we will know tomorrow night if those are going to fly. And I'm eager to get into that space. I think we can really make a difference, and I find it interesting. It's not on any political platforms because, frankly, it's not political, right? We need to move forward and ensure that we are safely and securely entering the digital space and not allowing it just to happen to our people because there's a lot of safety involved.
Good.
All right. Thanks, Dad.
Think about the text I sent you.
Okay.
With Kim?
Will do.
All right, and then we can talk later.
Thanks, Dad.
Thanks, everybody.
Luck with the surgery. We'll catch up next week.
Well, I just want to be able to see after I get done. That's all I'm hoping about.
That's a good goal.
Yeah, it's been kind of rough, so I'll let you know afterwards.
Well, all right,
love you guys. Be safe. Drive careful.
Dad. Bye-bye.
Bye.